So because so many of these people heading up healthcare, being that they're globalists, I wish there was, I see them as predators. I do. I do. Especially with AI and this technology. And whatever they say, they're going to say that nurses and doctors love it. And likely, if that is an actual true thing, they're likely new doctors and nurses. Look, the people that created this don't have empathy. They don't. They took care out of healthcare a long time ago. So that's why then you bring in machines and you say this is empathetic. In order to have something that's really good, if you really want to go, because one of the things, and I read this article a couple of times in videos. You can find it online. It's not a long article. It lays it simply out about socialism and how it will destroy America's healthcare system, which that's what it's doing. And ultimately that goes to globalism, communism. So, which is their desire. Of course, they will never say it. But he said in there how the people that head up healthcare, they spend all of this money, so much money on things, on equipment, because then it justifies their billing. And he said many of those things we don't even need. You see what I'm saying? So while they don't ever give the human being a raise, well, for decades now, while they have slowly pushed nurses out, while they say that it's because nurse burnout. No, the burnout is because of the inhuman people that have brought in AI. They know that they are. They know that they are, but they use it to their advantage, that they have burned people out, to say this is why we have to bring this in. And be aware of this. As AI becomes more prevalent, Epic, which is that Judy Faulkner, I did just a couple videos about her. Yep, she owns Epic, okay? She's been on board with the globalists a long time. And UW Health convened a group of experts earlier this year to advise lawmakers on how that technology should be used and regulated in healthcare. Do you see what they're doing? They're trying to control it. And they are the very people that need to be removed from it so that we can repair it. Bringing in all this machinery is not, it's a way to control you. It's going to we're already micromanaged. I can't stand that shit. I can't stand it. That's the worst thing to do to people, but dictators, slave masters, employers that are slave masters like that, they do that. That's what AI is going to do for you. And it has behavioral nudges. Now, to most people, and I'll show in a minute, to most people that would be like, oh, well, that's okay, a behavioral nudge letting me know I need to go do this or go do that. No. Like through your phone? No. No, you don't. No. That's because once it comes off as innocent in the beginning, but then think of George Orwell's 1984 or 83, whatever that book was, where, they're telling him he has to get up now to exercise. That you have to think down long term, because that's what they're thinking about. Behavioral nudges significantly increase adherence to regular mammogram screening. Everything they say about anything to do with AI and all of this technology will be positive. They will never speak the truth of this. But because this is always what they're going to say, this has increased people coming for mammograms. Mm-hmm. These are the same people, though, that have destroyed healthcare, because they were too busy with technology and the globalist agenda that they took the care out of healthcare. So it's very simple here. When you are a person that doesn't have empathy, and they don't, and you don't care, then what you will bring in is destruction. 3 health systems share their Apple Vision Pro plans. Cedars-Sinai Extend Reality, artificially intelligent. It's not even intelligent, it's artificial. Should we have that in healthcare. What we need in healthcare is human beings again. Developing and scaling remote patient monitoring capacity in ambulatory practice. Researchers at NYU Health studied the more than 8,000 patients enrolled in remote patient monitoring programs since the programs began 6 years ago. Patients use Bluetooth connected devices that send data to MyChart, and clinicians view the data in Epic. Well, and that may seem fine. I don't care. You may want to put all your trust in these experts. But I showed earlier how almost everybody's data has been stolen through cyber attacks. So does it seem responsible to be doing all of this technology? No. But again, there are people that don't care. I don't believe this one for a moment. Why nurses like AI for MyChart messages. A recent study found that nurses at UC Health liked using artificial intelligence generated MyChart messages at higher rates than their peers in other clinical roles. Nurses liked the tool's efficiency, empathy, and tone, and were most likely to say, you can see what it says, I can't see it because of the recording, and helped them stay within their scope of practice and reduce the need to forward messages to other clinicians. So do you see what it's doing? It will be such a micromanager that you're just a cog in the wheel. You're not there to help patients anymore, and a machine is your master. And yet you work in a field where what is most needed is human care. We need to remove all this technology because of the destruction it's creating. Mark my words, it'll create destruction because globalists are destructive. While they tell you that they're experts and while they tell you this will help, I have heard for the past 13, 14 years in my nursing career, how every new thing that the C-suite executives are going to bring down is going to help me, help my job, make things, it never, never, never materializes. Who it always helps is the C-suite. And this, as a mental health nurse, this is what I really wish I could keep these people and their equipment away from the mental health. Like, these are the same people that were doing lobotomies back in the day. I mean, not the same people, but that same mindset. It is. That's why, and who were lobotomies done on mental health patients? You know, a lot of things that are no longer done today. It's that, so those same type mindset people are, which they're really eugenists. That's their mindset, is eugenics. And they're still heading up healthcare. So I just wish just stay away from people in behavioral health. Like, you've done it, like, through your history of the ideology you follow, you've done enough damage. Wendy Wallace, director of Children's Hospital of Philadelphia Primary Care Behavioral Health, recently shared how she uses Epic and video visits to strengthen children's mental health and seek support in times of crisis. Yeah, I've had to do that when I've done, had to do assessments at certain hospitals. I think it's the most, I think when a patient is, I think if it's fine for a monthly visit or something like that, even though, you run the risk because Silicon Valley knows everything. So when you're doing all this online, who do you think's getting all of it? It's not a private thing, no matter how much they tell you it's safe. So I wonder how they get around the HIPAA violations, but look at the CEOs aren't held responsible for all the HIPAA violations they make. That the HIPAA rules only apply to the little people. Anyway, I think it's cruel in mental health. If somebody's truly in crisis, I think that you owe it as a human being to be present. But the CEOs and the C-suite, they want to do everything as cost-effective as possible. So doing it through telehealth, well, it serves them so they don't have to have more staff. UW Health doctors use AI to take notes, cut screen time at visits. It's all destruction, no matter what they tell you. I guarantee it.